Mr. Haas. Hi,
Mr.
Mr. Haas.
Hello.
I'm Linda.
Nice
Here to do a physical exam. How are you feeling today? You got any problems?
No problems.
No pain?
Nope.
Sleeping well?
Sleeping well.
Appetite's good?
It's good.
Bowel and urine all right?
Everything's okay.
All right, good. Well, I'm going to start with your vital signs. Oh, I
I was
forgot
gonna
to wash my hands. See, I knew I would forget something. As I'm going through, I'm thinking, okay, I have to make sure that I say everything, and then I stop myself and I start giving instructions. Okay, let me wash my hands first. And then I'm going to, we're going to get started with your vital signs. So, alrighty. I'm going to clean this because I don't know whose ears were in here last. I would have done that already. Alrighty, what's your blood pressure like usually?
It's usually normal, around 120.
We're at 122 over 82. Sound about right?
Sounds about right.
And you can walk over and write that down at
Hi.
that moment so that you don't have to remember those numbers. Okay. So let me get your pulse. Sorry. It is right in the right
Yeah, it's
spot.
right there.
All right. Okay, so what I did was I found the pulse, got my fingers on it so that I could feel the right pressure, and then you have a couple of options. I felt that it was regular. I felt that, so I knew that was fine. So I knew that listening to it or feeling it for 15 seconds was adequate. So what I did is I got my eye on the clock on the second hand, and I started counting his respirations. But I didn't let up on my pressure on his pulse because he thinks I'm just taking his pulse, right? So he doesn't change his breathing pattern, right? So you could take the pulse first and then listen to the breathing, but don't change your pressure on the pulse because it gives an indication that you're doing something different, all right? You want the patient to not know the difference between whether you're counting respirations or pulse, and you never tell them that you're counting his respirations.
You count for 30 seconds and multiply by 2.
You can if it's regular, you can count 15 seconds and multiply by 4.
Okay.
But if you're not confident with that, you're not positive that it's regular, then you can go 30 seconds and double it. Or you can listen for the full minute if it's irregular. Then I'm going to walk over here to my paper, and I'm going to write down the pulse and the respirations, and then I'm standing here with the paper and my pen, and then I'm going to say, can you tell me how much you weigh and how tall you are?
I am 6'5", 250.
All right, and then I'm going to write that down, okay? And that's the last time you can touch your paper. You can go over and write your blood pressure down. You can go over and write your pulse and respirations down and ask for the height and weight, you know. If you forget to ask the height and weight, try to remember it at the end, so because that's when you can go back to your paper, okay? So now I'm going to start with this back, just because I feel like if if you're doing, you can start at the head if you want. If it it helps you thinking head to toe, but I kind of think of the head as the front. I think of the head as part of the front. And now he's sitting up and his back is exposed. So now I'm going to come over and I'm going to listen to his lungs and then palpate and then percuss. So I'm just going to listen to your lungs right now. Take a nice deep breath for me. One last time. Excellent. Okay. Just gonna kind of take a look, feel. Anything tender?
Nope.
Okay. That all looks real good. All right. I'm gonna have you lay back now. Could have put the sheet on him when I first came in. But I should have. And he won't have shoes and socks on either. Okay, just gonna wanna feel around with your head, see if you got any lumps or bumps like that. Okay. I'm just feeling for lymph nodes here. I'll check through those after I lift up his shirt. Okay, go ahead and lay back. You can do this part while they're sitting up or laying down. It's however you're more comfortable. He's going to be easier for me laying down because he's tall, but it doesn't matter. You can, when you get done with the back, you can move to the front and do the head and look at the face and do that and then do your light stuff. I would do my light stuff all at once. You know, I'm going to do his eyes, and his nose, and his ears, and his mouth. I'm going to, just because I have the light in my hand, so I'm not putting it down, picking it up. But that's okay. You won't lose any points if you do it like that. But since he is tall and I'm short, it's going to be easier for me to get to his head. You know, I don't have to do all that reaching up. So, yeah, but even here, I'm short. Okay, kind of take a look at me. I'm just going to flash this in your eyes. Twice in each eye. Pick up your nose. Ears. See over here. I now have to move over that side to do that. Open up your mouth. Stick out your tongue for me. Lift up your tongue. So I can look under you. Excellent. Okay, good job. Oh, take a peek at that other ear. Okay, good. So I'm done with the light. Okay, so I'm going to take down your shirt. So the first thing I'm doing, obviously, is I'm observing, right? I'm looking, because inspection is the first thing that we do. All right. Okay, take a nice deep breath for me. You can lay your head back. Any tenderness? Now you can do the lymph nodes when of sitting up when you're doing the head and the neck, but for me it's easier after I've brought down the gown, you know? So now I'm gonna do my percussion down. Okay, so I'm not hearing anything different, but that piece of it was for the liver, right? If you want, you don't have to, but if you want, you can do it the same way going for the spleen. I'm standing on this side, so I'm just gonna kind of take a little feel for the spleen. Okay. Okay, now I'm just gonna kind of feel for your liver here. Okay. Now I'm gonna get to the belly, and I'm gonna auscultate first before I palpate all around the belly.
But you can palpate the spleen and liver for
Yeah,
before.
because you're not pounding, you're just kind of
Okay.
like feeling under the
and
rib
and
cage.
percussing there, okay.
Okay, I'm just gonna listen to your belly.
We switched the gown.
I hear it going. Did you have breakfast this morning?
Oh, I did not.
Okay. Your stomach is calling out for food. You auscultate in all four quadrants with the belly button being in the center, and you basically hold it until you hear a grumbly sound. You should always hear some grumbly sounds. You might hear more grumbly sounds if they're digesting or if they're hungry. You know, either way, they're going to be a little bit more, you know, grumbly. So, all right, I'm just going to kind of feel around. Any tenderness?
Nope.
Okay, good. All right, good. All right, so put it down back up. You can, I'm not going to tie it because I'm not sitting them back up, you know. So, okay, so I've done his head, his back, his chest, his neck. I've done all the mouth and nose and ear and stuff. I felt all the things. I moved down. I listened to his belly. I palpated for the liver and the spleen. So I'm done with his belly. Now I'm going to go to his legs, which we're going to do more of a, you know, pretend thing. Okay, so he's got his gown on up here. Hold it. Now I happen to know that it's fairly warm in this room, you know. But if I thought it was chilly, I maybe he'll get up, you know, or I ask him if he's feeling chilly or whatever. So, so now I'm just going to basically look at his legs and just kind of feel for muscle tone. Look at his legs, feel for muscle tone. I'm not asking him to do anything with his legs. Most of what I'm doing is I'm observing. I'm observing the skin. I'm observing muscle tone, feeling for muscle tone, that kind of thing. Then I'm going to move on down to the feet. Okay, I'm going to feel for the pulses now, and I'm going to not be able to feel them through his socks, but if he has socks on, you take them off, okay? I'm going to feel for those pulses, feel for those pulses. Hey, can you push against my hand? Excellent. Can you pull against my hand? Excellent. All righty. I'm going to have you sit back up. And I want you to squeeze my fingers as hard as you can. Oh, you're stronger than that. Okay. All right. Tie your gown. All righty. So, I forgot to ask, do you wear glasses?
Yes, I do.
Just for reading or all the time?
All the time.
You have contacts in?
Yeah, right now.
Okay. And any problems with hearing?
No.
Forgot to ask that when I was doing that talk because I was talking. It's hard to talk and, interact at the same time. I think if there's anything else I forgot.
The only thing I noticed is that you forgot to
Oh, I didn't
do
do
his
the I
thyroid.
didn't do the thyroid.
Yes.
Oh, you're
Are we
absolutely right.
doing,
And the JVP?
Anything
Nope.
with the, just with the,
If your hands are
hands.
strong and your feet push and
Jugular
pull across,
vein.
Okay.
I'm gonna assume that everything above that is good.
Okay.
That's correct. I forgot the
wanna ask.
thyroid. That's
I
right.
can play out.
And
Nope. I'm gonna just kinda-
Do you want us to do the carotid as well?
Yes.
Okay.
I felt that when I was feeling.
Okay.
Yes, when I was doing the lymph nodes, I was also feeling.
Feeling for the
pulses.
carotid? Okay.
And then you want symmetry for the
Pulses.
feet pulses in the radio, and obviously not the.
And when you're doing the hand squeezy test, do you, look for plugging in, or do you?
Yes, no, I looked at his
Observe
hands
for
as I
neck
was
veins
doing that.
extension.
And an awful lot of the observation stuff that you're doing goes as you're going by. It's what you're seeing, you
Okay.
know?
Okay.
You don't have to, for my purposes, you don't have to say, and now I'm going to look at your fingers, you know? Me,
I feel like I should, cause you're not gonna know what I'm looking at.
I will know if you didn't document it.
Oh, okay.
So, you see, it's the things that you're just doing by observing, you don't have to say out loud. You just have to document it, all right? It's that simple, you guys.
Mhm.
It's that simple, it's that short. And I did forget the thyroid. And I forgot to ask about hearing and vision when I was at his head, but then I asked it later. You're not gonna lose points if you ask about hearing and vision later, or if you ask about the weight later. Oh, by the way, how much do you weigh and how tall are you? You know, when you're done, you know? Okay, well, that's it for me, unless you have any questions or anything like that. All right, well, thank you very much for being such a great patient, and, you know, good luck with the next guy coming in, you know, you're gonna be here a while. So.